Tom doesn't know it yet, but he's about to become injured on the job. This is Dr. Smith. Dr. Smith is a busy healthcare provider who sees many patients. She's treating Tom for his work-related injury. And I'm Pam, a claims manager at the Department of Labor and Industries. Because Tom's injury was work-related, it's my duty to ensure that his medical expenses are covered and that he is compensated appropriately for any resulting time away from his job, and most importantly, that he's able to get back to work as soon as possible. Supporting those who've been injured on the job is what we do. While I'm quite good at my job, I'm not a medical expert, so I depend on Dr. Smith to provide me with important clinical details regarding Tom's condition. That's why, as many providers have learned firsthand, we at Labor and Industries are not shy about dropping a line when we aren't receiving the information we need to move forward. Fortunately, we're also here to help. Hi, Dr. Smith. Would you like some guidance regarding our process?
Yes. I would love some guidance.
Great. Let's go over some of Labor and Industries' key forms. The first form you'll encounter is the Report of Accident, or ROA. If you are the first provider to see a patient for a work-related condition, you are responsible for submitting the Report of Accident form to Labor and Industries. You can complete the form on paper or online at filefast.lni.wa.gov. The form is divided into two sections. The top section is completed by the patient and the bottom section by you. Your team can complete the form for you, but as the licensed provider, you must sign it yourself. Your patient may not recognize that missing or incomplete information in their section of the form may delay their treatment or benefits, so please encourage them to complete all fields. Most important are the date of injury or last exposure, a detailed description of how their injury occurred, and the worker's signatures. Fortunately, your section of the form is shorter than the patient's. Each field contains important information, but some in particular are more frequently misinterpreted or overlooked. It's understandable to list a vague diagnosis after first seeing a patient, as you may lack information pending further diagnostics or examination. However, we understand and expect that your findings are based only on what you know at the time. Please use your best clinical judgment to provide a clear and specific diagnosis. If you're waiting on more information, you can adjust the diagnosis later. We need the correct ICD code for each diagnosed condition. This helps expedite benefits for the patient as well as payment for your services. One area that is often not specific enough or even totally blank is the objective medical findings field. Objective is the key word here. We need findings that can be seen, felt, heard, measured, or reproduced by the provider through examination or testing. For example, inflammation and reduced range of motion are clear objective medical findings. However, pain and tenderness, while often noted as objective findings, are not. Another of the most important fields from our perspective is whether the diagnosed condition was caused by the patient's work-related injury or exposure. If you're not 100% certain, you can express that with the probably and possibly options. Medical evidence shows that keeping a patient at work is actually in their best interest and helps expedite recovery. Of course, there are plenty of instances where this isn't possible. Give us your best possible estimate as to how many days of work your patient will miss, if any. This is especially important for the patient, as we may need to compensate them for their time off. There are 3 dates you will note in your section of this form. We need to know the date you first saw the patient for this condition, the date of this exam, which is the date you completed the Report of Accident form, and the date you signed the form. Finally, please print your name and NPI number. Because this is a billable form, including this information will ensure timely payment. The Report of Accident form is due within 5 days of the patient's first visit, but sooner is better, especially for the patient. Another important form in treating patients with work-related conditions is the Activity Prescription Form, or APF. The APF communicates your patient's physical restrictions and ability to work, as well as your treatment plans. We use this information to determine benefits for your patient when they are unable to work or to help their employer identify appropriate light or modified duty jobs for them. You should submit an APF with the initial report of accident when the patient has physical restrictions. After the initial visit, you'll need to complete an additional APF whenever you document a change in your patient's medical status or capacities. For more details about when and how to complete an APF, check out our education module devoted entirely to the topic. Patients who aren't back on the job within 6 months of an injury have only a 50% chance of ever returning to work. Therefore, we support getting a patient back on the job as quickly and safely as possible, within the patient's physical restrictions. In order to get your patient back to work safely, you may need to provide your approval based on an overview of the physical demands of the patient's job as submitted by their employer. Many employers use our employer's job description form to document all of the necessary information. The employer completes the job duties and physical requirements needed to do the work. As the patient's healthcare provider, you'll need to complete the small section at the bottom of the form, either approving or denying the patient's ability to perform the duties in question. In more difficult situations, it may be necessary for the patient's employer to bring in a vocational rehabilitation counselor to prepare an in-depth job analysis for your approval. A job analysis form is significantly longer and more detailed than the job description. After reviewing the information in the form, you'll need to complete the final page, where you will choose one of several options. You can approve of the patient's ability to return to work at the job duties described. You can temporarily deny the patient's ability to return to the modified position, which requires a treatment plan and a release for work date. Or you can permanently deny the patient's ability to perform the job duties based on specific objective medical findings. We work very hard to support your patients who've been injured on the job, but ultimately it's your expert clinical judgment that allows us to move forward. Therefore, timely completion of our forms is always critical. We understand that even a single extra piece of paperwork can be burdensome in the context of a busy medical practice. If you are ever uncertain about how or when to complete one of our forms, you can visit our website, lni.wa.gov, or call our provider hotline at 1-800-848-0811. We appreciate your contribution and shared interest in the labor and industry's mission to keep Washington safe and working.